All right, we're back again with another pose of the week. This kind of builds on the Side Sit series. So I want you to tie a piece of TheraBand. If you haven't seen the Side Sit series, you may want to stop and go back and watch that one first, because we're going to use the same TheraBand we had on for side sitting. This is called a Side Sit Sphinx. You're going to need a squishy kind of myofascial release ball, okay? This one I got is a Pilates based. It's called a stability ball, used for exercise, but we're using it for something else. In the, and make sure it's squishy and kind of wrinkled. You don't want it fully inflated. So that's the first piece. The second piece of this is your TheraBand tied on, because I want you to back rib breathe here, okay? Really get some expansion. The reason is, oftentimes we overuse certain muscles in the abdominals, which can push down on the pelvic floor and then make our postpartum or prenatal or low back or hip pain symptoms even worse. So we want to unload the pelvic floor here. You're going to put your knees forward and stack them. So it's like this. You're going to put the ball not directly on your side, but slightly forward of your side, so it's here. Okay. Then you're going to rotate your upper trunk. You can rest down for a time. You can do this for a couple of minutes and just breathe. Inhale. Let your breath be the myofascial release you're looking for. And when you're ready, you can press up into Sphinx. So the shoulders are squared and rotated forward, but the body is rotated in the opposite direction over the top of the ball. The ball is above your iliac crest or your hip and below your rib cage. It is not in the midline of the belly, it's off to the side. You can even roll around a little bit on top of the ball. So I'll show you that here. You can stay up in Sphinx, or you can rest back down. Targeting, releasing some of those snarky psoas, and related type of hip flexors, including the deep muscles in the low back. Some of those are called the quadratus lumborum, that get tight, but that when you stretch them makes your hip or pelvic or back pain worse. So we're not really stretching, we're compressing them to get them to release. So instead of stretching, we are getting a similar goal of trying to stretch without having to do the stretch, if that makes sense. So we're going into the less painful direction of compression, which is an indirect release, instead of trying to just stretch, which can sometimes make it worse. Especially if you have joint instability, it can make it worse. All right, and that's it. That is the side sitting Sphinx. All right, hopefully that helps you to breathe a little easier here. Open up the back ribs, unload the pelvic floor, and release some of this tightness and stiffness that we can feel in the hip without having to stretch at all. All right, until next time.